Join Drs. Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years, in our careers. There's a reason it's called practicing dentistry. Hello and welcome back to Beyond Graduation with Dr. Craig and Dr. Sartor. This week we are talking about our experience pursuing GPR programs and how that has impacted our careers thus far. So we'll start with you. You've been out of residency far longer than I.
I know.
If you had to go back in time and do it all over again, would you do it?
I 100% would. Right out of dental school, my confidence level was definitely nowhere near where it needed to be. And because I'm from a rural area, I knew that it was something that I wanted to do when I, graduated dental school. I wanted to practice in a rural area. So I wanted the ability to feel confident enough to where if a patient had complex medical history or, complex dentistry that needed to be done, I felt confident enough to do the dentistry, but also confident enough to know when it was out of my scope and when I should refer. How about you? Would you do it again?
Oh, yes. In a heartbeat. Yeah, I just knew personally that I needed that. I needed that extra year in so many ways. Clinically, personally, professionally, it was the best thing I ever did. And there are still, I've only been in private practice for a few months, but there are so many moments where I'm like, I wouldn't have known what to do. And I think the biggest thing for me at this point is knowing my limits. Had I not sort of pushed the envelope for an entire year with backup, I wouldn't be so firm in my nose as I am now. I know what my limits are, I know what my comfort level is, and I can, in full confidence, say, no, this isn't for me. And I wouldn't have had that coming right out of dental school.
Yeah, it's very interesting, especially how, now some states, you have to complete a residency in order to, get your license and be able to practice. I'm not sure about your dental school, but my dental school pretty much had just about all of the specialties. So
yeah, we did too.
I think, there are some schools out there that have like no specialty programs, and I think they have potential to graduate some dental students that have more of a diverse portfolio in terms of different types of patient cases. But I think overall residency for me was just the additional boost in confidence that I needed, especially as it pertained to patient management and team management and all the things, just incorporating everything together and seeing more than 2 patients a day,
Yeah, and I think it allowed me to explore all of those things in a safety net environment. Like I couldn't imagine personally. People do come out of dental school and go into private practice and succeed, but I would be so stressed trying to navigate all of the nuances of private practice and working in that system and, somebody else's sort of, somebody else's court, versus I had that year to figure out myself and my abilities. And I think it's so funny to look back, like what I thought I would get out of residency was like, oh, I can do all these cool procedures and look, and I can, but more so it showed me like my limitations and my comfort zone of, we were talking earlier, like if I'm going to refer something out, there's a reason, and I can trust myself and not really be pushed. I'm more strong on my own feet and in my own backbone to not be pushed against by, my colleagues or my patients or my team. Like we always say, you always tell me standing in your values and let your nose be nose. And they are now because of that year.
It's awesome. I think one of the important things that I learned from residency as well from the program directors was that, it's the practice of dentistry. And, dentistry is always ever changing. The main things, the main principles that we learn in school, for the most part, remain the same, but it's evolving. And in order for us to be the best providers that we could be for our patients and for our communities, we have to evolve too and learn. And I think that's one of the things that I took from residency for sure.
Yeah, that lifelong learning piece was really emphasized. Yeah, I the more residency for me was like personal growth, even beyond just like clinical skills. Like I'm not scared of extraction like I was coming out of dental school for sure, but the personal growth was just unbelievable. And just the confidence when I walk into a room that I can do this and I know that, I know what I know.
Especially another thing too was like, coordinating and communicating with other specialists, but also primary care providers and cardiologists and all that sort of thing, and not being afraid to reach out and get a consultation in terms of whether a patient is able to hold their medications if they're on anticoagulants, and to pick up the phone and ask those questions. If you have a question about, okay, what are my limitations if I have to take teeth out on this patient, but, they have cardiovascular issues,
That like confidence that you're a member of the healthcare team in addition to all of these other providers, I think was really emphasized to us.
And I think what I liked more than anything, our residency program had, a certain day out of the week for treatment planning where, it's almost like a round table and just looking at cases and hearing how other people would treatment plan a case and why they would, I feel was super important to me because it gave me different ways of treatment planning the same case.
Yeah.
And, it is always that one option is better than the other. Sometimes you just need a backup for if option A is not a possibility.
Or like more long-term treatment planning of, okay, if and when this fails, can we use this for something else? Or,
Yeah, I think in dental school we learned a lot about, single tooth dentistry.
Yes.
And, towards the end of dental school, they try to say, okay, look at the whole picture. That's that one tooth, but what about the rest of the mouth? But I think residency for me really did tie in, how to look at the whole picture instead of just focusing on one specific thing.
Yeah. And I think there were so many aha moments in residency of like, oh my gosh, this is what they were trying to tell me, in occlusion semester 2 of D1 year. And I had no background experience to like understand those concepts. Like, they have to teach you everything, but sometimes it doesn't make sense until you've seen it enough times in real life.
For sure. I think that goes back to the lifelong learning piece that we talked about too, because, it's some stuff now in my CE courses that I take that it'll come up, and I think back on cases that I did, in my earlier years as a young dentist, and I'm like, okay, I see why that did not work.
Yeah.
And now I know how to not make those mistakes in the future, or how to see it as being a potential problem before doing anything and making the patient aware of it. and planning accordingly.
Yeah. And I think that was the really cool part about residency is like, not only did you have, my experience, my co-residence experience, our faculty had been there for, been in their careers for so long, but had also been supervising residents for so long that you also had like the experience of 20 years of residence, for them to be like, these are the things we have seen go sideways. This is how we deal with it. And, whether you had, the implant fail or the screw break off in the tooth or not, you at least learned how you could handle it when it happened to you because somebody else has had it happen.
What advice would you have for a young dentist who is in dental school right now and is trying to determine whether they should go right out into the workforce and start trying to make money to pay off their student loans, or if they should invest in themselves and take that 1 year to do a residency, or 2 years, or more, depending on if they decide to specialize? What advice do you have?
I think there's so many factors. I think there are people for whom, for so many reasons, residency isn't the right choice. Some people are like, I just can't do any more school. I can't. So I think you need to really do some self-reflection about what you want out of residency, and if you have the capacity to really dig in and get the most out of it for that year. Because I've seen friends and colleagues who, felt like they should do a residency and got in there, and, you're always going to what if, some of the other experiences, and the money is a big part. So I think if you're not 100% open to the learning experience, I don't know that it's necessarily for you. And that just takes self-reflection. I also think not every residency program is created equal. And so just doing a residency to say you did a residency for me wasn't an option. I wanted specific things from a program, and if I wasn't going to get into a program that gave me that, then I was going to consider another way to get there. So I think, I made lists of like, these are the things that I definitely need in a program, or I'm going to try to find an associateship that provides me that mentorship. And I also think mentorship is a buzzword. And so what is that actually, if you've got an associateship with mentorship, quote unquote, in one hand versus a dedicated year with faculty that are being paid to mentor you, trying to understand if that associateship actually has what you're looking for and what you need from it. What about you?
I think you brought up some very, very great points. I do believe that, if you are considering a residency program and it's within your means to take a visit to that residency, it's extremely important, because there were some residency programs that were on my list that once I went to visit, I realized that it wasn't what I thought it was going to be.
Yeah.
I even had some on my list that when I went, the current residents were telling me not to come to that program. And so, if that's, all of the residents there are telling you that, then something potentially is not right. And, it's better to try to find the program that speaks to who you are and who you want to be as a dentist.
Yep.
But like you said, if residency isn't your thing, I know lots of people who right out of school, they say, you know what, I'm not going to do a residency, but I'm going to, spend my money on continuing education with, Pinky, Spear, Coyce, Dawson, or I'm going to go and take, a Maxi course and learn how to place implants, or, those are all great things too, because in those major continuing education programs and curriculums, you find mentorship from the teachers as well as, the people that you're in those classes with as well.
Yeah, I think the biggest thing is just, as much as it absolutely stinks to hear, learning does not end the day you graduate dental school. Like, there's just so much more to learn. And it's like frustrating because you're like, I just paid so much money and time to get this degree. But
it's interesting. I'm currently doing the Dawson mini residency curriculum, and I'm learning so much stuff now that, you know, it's not a class or course that doesn't go by that I don't think to myself, man, if I had learned this in dental school, I would be like so much further along. But part of it is, in dental school, most of us went with like bare understanding.
yeah.
And so when you start talking about advanced concepts, like, while in theory it would have been great to learn some of what I'm learning now back then, I don't know if my poor brain would have been able to grasp it, you know, because, you know, we had tests like almost every day, and then you're trying to learn how to do dentistry and use your hands in a way that you've never used them before. So I think, you know, it's, as a person, you'll know when, you know, you have to challenge yourself more.
Yeah.
And when you feel that, definitely listen to it and find it's so much continuing education out there. You just have to find what speaks to you and what you think you need at this time and what can, you know, benefit your patients.
Yeah. I think that's makes me think of another interesting thing for me in residency was like, that was the first time in my life that I was learning for the sake of learning, you know, without tests, without, you know, curriculum. You know, there were some structured lectures and things like that in residency, but, you know, I would have conversations with the program director about like, you know, tell me how I'm doing. Like, did I get, you know, an A in placing a class 2 composite? And it's like, at this point, you are your own internal, you know, achievement barometer. And like, I needed that year of like still having an occasional like pat on the back and, you know, you're progressing, you're doing good things, because now in private practice, for better or for worse, nobody's checking my work. You know what I mean? Like, and I needed that year of learning for the sake of learning and for the benefit of myself and my patients without.
Understood. Yeah. In retrospect, I would do it again 100 times over. So, you know, we always talk to you guys about listening to your heart and listening to your mind and what you think is best for you and where you are at this point. Ignite DDS definitely has resources that can help you in your process of figuring out what residency programs are out there. I'm going to let Savanah tell you guys a little bit more about the residency guide and how you guys can find it.
Yeah. So finding a residency, you know, they change all the time, and it can be hard to know how to compare what's even offered in different programs. So at Ignite, we've created a PDF, a residency guide. We update it as often as we can. So ignitedds.com, go to the ebook references, and you can download the ebook for free. It's got some tips, tricks, articles, and lists of many, many programs throughout the U.S. So take a look through and find the program that's right for you. And we will see you all back here next week.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr. _Sartor. And remember, you are not alone on this journey.